We have got Laban Thega. Where is Laban? He's around. Laban Thega is acting director for health services. And where is Mamo? Oh, Mamo, yes. And Mamo, head of the division of the National Public Health Laboratory Services, who are the people who actually do the samples. But in addition to those friends, and before I open the floor for the media to ask the questions, I have also accompanied by another friend whose name is Kawala Amina. I want to invite my friend here so that you can greet her and she can make a speech. Maybe you can bring down this. This is my friend Amina. Amina, please come here. Yeah, right there. And let's listen to her.
Hi, my name is Haula Amina, and I have a plan for coronavirus, and so that people can know that corona is not a joke, and I'm the voice of the little ones. COVID-19, lockdown, curfew, keeping distance. Who will explain to me? I'm not going to school. Mommy says no friends in the house, no going out, no greeting, no good night hugs. Only wash your hands, wash your hands, wash your hands, wash your hands. Keep your distance, keep your distance, keep your distance. Stay home, stay home, stay home. Wear mask, wear mask, wear mask. Who will explain to me? Mommy is not going to work. Always working on the computer. How now? Home is not job. She's not talking to me. Working. I watch my cartoons. I read my storybooks. I draw pictures. I enjoy. But I don't like it. I miss my friends. Someone explain to the children, what is corona? Where did it come from? Why has life changed? I'll make a prayer. Dear God, bring back our lives. Cure the people in corona. I know you hear little children, but I beg you, take away corona. But remember, if we treat this disease normally, it will treat us abnormally. Thank you. This is Haula Amina, the voice of the little ones. Bye. Mwah. Thank you.
Thank you. Thank you very much. I think the message is very clear. And if Amina knows about this disease, then you should know about this disease. Thank you so much. Thank you, and God bless you. Let me now give an opportunity to the members of the Fourth Estate to raise one or two questions, and then we can call it a day.
Thank you so much. Good afternoon, Waziri. My name is Melita Oletenges from NTV. My first question would be, Nairobi Senator and the chair of the ad hoc committee on COVID-19 pandemic was arrested by over an allegations of drinking over hours. Perhaps what is your stand on that, and what action will be taken to the senator and the management of this particular establishment where he was caught? And do you also, in your capacity, are you aware that there are bars which are running, and what measures would be taken to such bars that are running after curfew? My last question is, Waziri, many politicians have been seen breaking the rules of COVID-19. Perhaps this matter has been being brought forth and back and forth between your ministry and the Interior Ministry. Perhaps because this is being implemented on account of concerns from your ministry, what would you say regarding this particular politicians, and what actions will be taken against them? Thank you.
Afternoon, Waziri. My name is Moige William from TV47. My question to you, Waziri, is some religious leaders have complained that the protocols laid down before they are allowed to reopen are very harsh, and there are fears that religious places might be the next hotspot. Maybe what is your concern on the same? Thank you.
I'm Sarafina Roby from KBC. My question is in regards to the number of beds. You said that a number of counties have already met the required capacity. Perhaps what are the statistics? And also in regards to the Cuban doctors that you mentioned yesterday, how much is the government spending on the Cuban doctors? And also, what are the plans in employing more doctors?
Waziri, my name is Njagi from Ovoro TV. My question comes from isolation centers. How safe are they? Because this morning we had a police officer was caught with a patient. How safe are the isolation centers, and what is your ministry doing to make sure that the patients that go for isolations are safe?
Thank you very much. Okay, one more then, the final one.
Waziri, my name is Ruben Githinji from the Star newspaper. I would like to know, elders from Membu some times ago proposed that herbal medicine be tapped in order for it to be seen whether it can cure corona. Is there any attempt that the government has done to find out whether corona can be cured by through herbal medicine? And then the last question is, in Turkana, in the media yesterday, we were shown some residents from Turkana conducting marriages and all kind of public gatherings. And it could be seen that they were not obeying regulations of the government. What is the government doing to prevent such things?
Thank you very much. Let me start. I think that one, the Turkana one, and Mirita's question are essentially the same. And they revolve around the issue of gatherings and the issue of alcohol being sold. I had alluded to that a bit earlier. And you also mentioned about politicians and their misbehavior. Let me just say this. When we talk about responsibility, and we talk about personal responsibility, two things are in collusion here. One is that as an individual, you have a choice. You have a choice. When you see a public gathering, or when you know that a politician has invited a public gathering, you have a choice of to go to that gathering or not to go to the gathering. Why go to the gathering and then you start complaining that Mutahi Kagwe had called a political meeting and he is not keeping social distances, and you are the one who is there? What are you doing there in the first place? How can you go to a place, or the religious one that you are saying? You go to a church, you sit there, you can see there is no social distancing. Take personal responsibility. Get out of there. Because you cannot say that the police should stand out here on this Embu Road here and stop everybody from crossing because there might be a car. It is up to you to look left, look right, decide whether you want to cross or not. So I want to start from there. The fact that when you see these political gatherings, you don't have to be there. Don't go there. Because the second thing is that it is obviously extremely irresponsible of politicians to do so. It's irresponsible. And it is bad when it is our leaders. You know, it is bad when it is our leaders who have those political gatherings. And I want to warn that people should be aware, and I guarantee you, if you go to those gatherings and you get infected, you will not see the politician who had asked you to go there. You will never see them. We have also known politicians who have actually caused infections to people and denied completely later that they are the ones or they were anywhere near COVID positive situations. We have seen it. So I urge the public, do not fall trap to going to political gatherings. Just don't go. If you all refuse to go, then politicians would be standing there speaking to themselves. And within no time at all, nobody would go. Nobody would call a meeting. They call a meeting because they know you are foolish enough to go. So if you stop and you become wiser, it won't happen. I am not condoning it. I am saying it is very irresponsible. It's annoying, really. But, and it's the same applies to the alcohol situation. And you are right, Mirita, that the Ministry of Health is not an enforcement agency. The role of the Ministry of Health is to point out, to say that you are not supposed to open a bar. Bars are not opened. So if somebody is opening the bar, and in fact we have also seen some people now pretending that theirs are restaurants, when as a matter of fact they are bars. So when it is those kind of activities that then force the government to take very stringent measures, the closure of those bars, we have closed quite a few in Nairobi, and we will continue to close those bars. And when we close them, there is no reopening. Because to reopen, you need a license. You need a health certificate. You need to be certified as a healthy place. So you'll not get a health certificate. So you're not open again. So why take a risk to kill people during this COVID-19 and in the process also be closed down? It is just plain foolish. And we hope that people are going to refuse to go to those bars. Because after all, as I said, it is a personal responsibility to enter that drinking den. Seraphine, you asked about, I think I have answered William's question in the process regarding religious hotspots. I think, remember, that the measures that you are talking about, the protocols, were developed by the religious committee itself. You know, we work together with them. We work together with our religious fraternity led by His Grace, Archbishop Muheria. We work together with his team to develop the protocols that you are talking about. So it is the least and most attractive level that we can be able to work with under the circumstances. And you'll also know that a lot of religious organizations, Muslim communities and others, have actually said that in spite of the fact that we have developed protocols, they have seen that they cannot be able to follow the protocols. They cannot be able to contain people the way the protocol proposes, and those who cannot be able to contain the people in accordance with the protocol are not opening. And it is themselves who are making those decisions. And we are grateful and thankful that they are doing that. On the matter of the Cuban doctors are being paid like our own doctors. We are not paying any more than we pay our own people, and I would like that very clearly done. Unless somebody starts saying how we are paying foreigners more, we are not. We are not doing so. It is a small brigade of 20 doctors who have come, specialists in their own area, and their purpose really is just to come and exchange skills with our own doctors, so that, and they also learn from us. They learn from us and we learn from them. It's a healthy exchange. But that brigade will be moving together so that in the event of a serious outbreak, for example here, then they can all come together, 21 of them, to look at the various assistance that they may be able to get. And yes, we are continuing to hire doctors as the situation evolves. We are short of doctors in the ministry, and we are looking at how to increase capacity. So it's a continuous process. As we get funding, we hire more doctors. In the issue of isolation centers and the care of isolation centers, we are very, very, at the moment, we are happy with what we have seen. I am not actually sure, Jaggi, about, is it that you said a policeman was caught in an isolation center and he is not sick?
With a patient.
Huh?
He was caught with a patient.
Caught with a patient doing what? Why would you be caught with somebody who is positive unless you are completely foolish? Anyway, I don't know what he was doing. You know, Jaggi, what he was doing. I don't. So I am unable to comment on his goings-ons. Githenji, you said that you asked about the issue of local materials for use to combat COVID-19. Again, there is nothing like that. As far as we can tell, so far, no vaccine and no cure has been discovered for COVID-19. And therefore, the rest of it is a trial and error. Maybe it can work, but I think that the best thing for them to do is to present it to the Ministry of Health for testing and otherwise, so that we can see whether it indeed works. So I want to stop there, and I want to ask Dr. Amoth to just say something very quickly about two things. One is to do with home isolation, that we want to really people to understand what home isolation is all about. We would like the public to understand what you do when you have got your patient at home, and the possibilities of you having a patient in your own house. And perhaps also, at this moment, it is also good for us to mention to the people of Embu matters related to universal health care, and the fact that the government has put aside a substantial amount of money that we want to start giving NHIF cards to the people, the most vulnerable people, because going forward, UHC is going to be predicated on having a card, not just walking into a hospital, but everybody will be having a card that you can go with to a hospital. And it will be an electronic, we are all going to go electronic. You are going to predicate it on ICT, so that it's a smart card. When you swipe your card, we will be able to know, even at NHIF, what has transpired, and your sickness, and so on and so forth. So maybe, Dr. Amoth, you might want to mention a little bit about those two things.
Thank you, Waziri. Regarding home-based care, the WHO, World Health Organization, developed guidelines on home-based care for COVID-19, and this was premised on the fact that a majority of the patients all over the world were symptomatic, and therefore it is imperative that if you are positive and you are symptomatic, there's a possibility that you could be managed from home. Based on that, we took the WHO guidelines through the case management team at the Ministry of Health and the COVID-19 task force, customized home-based guidelines from WHO to suit our local needs. So what we require for home-based care, which are defined simply by home-based care, simply means taking care of somebody who is sick but relatively stable in a home environment under the supervision of a trained healthcare worker. And there are very many advantages of practicing home-based care, because one, people recover best at home because the environment is familiar, the family that supports you, there with you, and you are at home in a situation where you don't feel like you're out of your normal settings. Based on that, we came up with these simple criteria. One, of course, you must have a positive COVID-19 test from a certified lab. Number two is that you must be asymptomatic. So if you have any symptoms of COVID-19 like cough, difficulty in breathing, or fever, you don't qualify for home-based care. Number three is that you must not have any coexisting medical condition like diabetes, hypertension, cancer, chronic kidney disease, and the like. Number four, you must have a space within your home where you can be able to isolate. It must be a well-ventilated room, separate from the rest of the other rooms. You must have a caregiver who will be able to provide you with support in terms of bringing you your food and all other supplies that you may require. Preferably, you should have separate toilet and bathroom facilities. Then you will be able to supply with you with basic PPEs during your period of isolation, and a raft of very many other measures that are clearly articulated in the home-based guidelines, which we have shared with the counties both in English and Kiswahili, and we appeal to the counties to be able to have an abridged version of home-based care in a local dialect, because eventually, as we go towards home-based care, it will rest on the individual members of the household to provide that care. So we also have a rigorous monitoring and evaluation system to ensure that only those who fit that criteria go for home-based care. They are monitored throughout the 13, 14 days period. Then we also have a referral link to the facilities in case somebody needs to move from home-based care to institutional care. This is because as at now 90% of our cases are asymptomatic. And if you are to manage asymptomatic cases in institutional facilities, the cost is about 21,000, again driven primarily by use of PPEs. So we'll be saving a significant amount of money. Patients will also be recovering best in a home environment where they are more familiar. And we have practiced this before during the advent of HIV/AIDS, when we practiced home-based care successfully, to a point where now we are capable, the lessons that we have learned from there, quickly we can be able to deploy to home-based care for COVID-19. We are also training community health volunteers. So far we have trained more than 60,000 through an online module, and these are the frontline workers who are going to supervise home-based care and link people to the facilities in case they require to be moved from home-based care to institutional care. So Embu County would also, now that you don't have any cases, this is the best time to be able to train your people in preparation for in case there's a surge in the numbers. So far in general, our numbers, even though they are increasing, the healthcare system has responded in a very resilient manner. We are not being overwhelmed. As of today, we have 1,010 people admitted in our facilities throughout the country. Out of these, 40 are in ICU, 22 on ventilatory support, 15 requiring supplemental oxygen, and 3 on observation. And this trend has continued to obtain for the past 7 to 10 days. So as we count the days towards the proverbial 21 days after the lifting of the restriction in movement, we are so far happy, and if we continue this way, the healthcare system will be able to cope. Finally, in terms of UHC, of course, universal health coverage is premised on primary health care is the way to go to deliver healthcare services, because it is cheap, it is affordable, it is within reach of the community. It is for this reason that this year the government has allocated Kenya shilling 6 billion for UHC, and they want to use this money to be able to cover the vulnerable, that is the people with disabilities, people with chronic conditions, people who are extremely poor or the indigent. And we are working with the counties to identify these people together, and then we'll be able to give them NHIF cards, to give them what is equal to or similar to the super cover that we have. And from that investment by the national government, Governor, will plead with you that you match our contribution for Embu County. If we cover 20,000, maybe you can give us 10,000, or if you are gracious enough, you give us another 20,000. That way we'll journey together and ensure beyond COVID that our health system is much better and our health indicators improve. I thank you.
Thank you very much. Thank you very much, Dr. Amoth. I think that was important information, particularly to the people of Embu County. I also want to take this opportunity to say that we have heard your cry of the equipment that you wanted from yourself and from your medical staff. I am aware that our brothers from Kemri were here, I think last week or the previous week, to look at the potential of the lab that you have got here, and to see whether we can work together to create a testing facility here in Embu. I know that there are a few things that are supposed to be corrected. So as soon as that is done, we will then move equipment so that we can start testing here in Embu. The second issue has got to do with your oxygen plant. You said that, and I saw it myself, it's a very small plant for the kind of demand that you have got here. Is only producing about 80 liters per minute. But as you are aware, Embu is earmarked for support through support for that facility through French government commitment that has been made, and therefore we are in the process of straightening that issue and working with them. I'm sure we can be able to assist initially with a plant, an oxygen plant that will produce 400 liters per minute. As we came here today, we also came with some goodies for you. I know that we have got some 4 more ventilators for you, and that's and also additionally 4 more patient monitors alongside other material that we have brought for you. And it is in recognition of the excellent work that is going on amongst the healthcare workers that we are enthused to support Embu. And I wish to appreciate the following members of staff of Embu for their exemplary performance and support of others. The first one, number 1, is Rosaline Kaugi. Rosaline, thank you very much. He is in charge of emergency. Maybe you better stand here so that the media can, you look at the media, face the media so they can see you. I think they much prefer to take your picture than mine. She is in charge of emergency and operations of COVID-19. She coordinates the county and 4 sub-county response teams. She further coordinates 37 multidisciplinary subcommittees on COVID-19 within the county on preventive services tirelessly. Thank you very, very much, Rosalind. The second one is Dr. Kwalib Ali Abdi. Daktari, medical officer, working in critical care department at Embu Level 5 Hospital. He is a trainer of trainers on COVID-19 and has been tirelessly involved in training of some 1,562 healthcare workers. And I can tell you, Abdi, that your passion comes through. Even when you are explaining to me about what is happening in the hospital, your passion comes through. Thank you very much for your help. The third one is Dr. Samson Ilewa. Where is Samson? The medical superintendent for Runyenjes Level 4 Hospital. And we appreciate Daktari, your dedication and commitment in management of COVID-19 suspected cases. He has so far successfully managed over 50 suspected cases. Asante sana, Daktari. Thank you very much. I also want to recognize Molly Jue. Where is Molly? Molly, karibu. And Molly is a nursing officer in charge of Embu Level 5 Isolation Center. For her effectiveness in managing the isolation center, Molly, thank you so much. She has successfully nursed 2 confirmed cases and 24 suspected cases. Thank you very much. Thank you very much. I also wish to recognize Derek Munene. Derek Munene, driver. He's an ambulance driver. Munene, asante sana. Munene is an ambulance driver in Embu Level 5 Hospital, and he took the response team to evacuate the very first case recorded in Embu County without fear, but I hope you had a mask on. He has, and so far you look good, so I'm sure you are all right. He has evacuated close to 1,000 suspected cases. Asante sana. Thank you very much, Monene. Thank you. And on that note, as these people work, let's also remember that we should not stigmatize. We should not stigmatize the people who are suspected, the people who are in quarantine facilities, or indeed the people who have turned positive. There is no difference between a person who turned positive and then went negative. In fact, there is no difference between you and a person who is positive. The only difference is that you are not positive. That's all. But otherwise, the person is a person like you and I, and any one of us can't get it. Any one of us. So let's not stigmatize anybody because they are positive, or we suspect that they are, what we should do is empathize with them, take care of them, assist them, pray for them, because today they are the ones who have that situation. Tomorrow it's you who has that situation. I also want to take the opportunity to thank the administration. Thank you very, very much indeed, because they are the ones who co-chair the response committee. And I want to say that I am pleased that in Embu, the national government, the administration, the county commissioner and his and your team is working very, very closely to ensure that we keep the people of Embu safe. I also want to say to you that we are very, very pleased with kazi mtaani and what you are doing with it. Vijana wale ambao wanafanya kazi kule mitaani kusafisha, cleaning up our place, keeping up hygiene measures, and we are very, very pleased with what we are doing. I think here you have how many? 2,896 vijana, wasichana na vijana wanafanya kazi hapa Embu because of a program that was launched by the president to keep our places clean. We want them trained. We want them to really assist us to clean up our place, but not just cleaning. They can do a lot more. We are appealing to them and to the county government, working together with the Kazi Mitaani people. We can even paint the town. We can plant trees and continue foresting our county. So there's a lot that we can do working together. These over 2,000 people are actually being paid by the national government in continuous support of the hygiene measures. Because tukiwa wasafi, hiyo ndio kitu ya kwanza. And going forward, post-COVID-19, prevention that was talked about by the governor, prevention is going to be key to how we tackle disease going forward in this country. Because prevention is simple. You keep on washing your hands post-COVID. We want to keep our houses clean. We want to keep our streets clean. We don't want people dumping rubbish all over the place. And it is important that we maintain that. I also want to thank the county legislator. I can see the speaker is here, with the chairman also of health is also here. And I want to thank you for the support you have given the government of Embu and the way that you work closely together. When people don't understand that governors must work very closely with the county legislatures, because that's where the money comes from for combating this disease. And unless the team in the Embu County pass the money for use by the governor, then you'll not have money for use. So I want to thank you and to ask you through the speaker to thank you and to ask you to please continue with that good work. I want to thank the people of Embu. Tafadhalini, tukae hivyo hivyo bila COVID-19. You save me, I save you. Thank you. Okay, like a social distance, we are going to be, we can't present until we are keeping social distance. Please keep social distance. And let's keep the people of Embu safe. Asante sana, thank you very much.
Kwiragwo handu hari ndogo hatiagaga mwaki. na dogo ni